Hello, my name is Joseph Gerbel. I have formulated this presentation on diabetic education as part of my health education project for community health nursing at Indiana State University. My population at risk is type 1 and 2 diabetics, pre-diabetics, and people at risk for diabetes. After watching this presentation, viewers will be able to differentiate between type 1 and type 2 diabetes mellitus, identify disease process, evaluate effects on the body, recognize management of disease. A quick outline of this presentation includes common terms, diabetes type 1, diabetes type 2, symptoms, risk factors, effects on the body, testing and diagnosis, medications, and diet and lifestyle changes. Before we go any further, please pause this presentation and click the link below the video. I have developed a short pre-test to assess your current knowledge about diabetes. I have included some common diabetic-related terms. Diabetes insipidus, it's an increased urine formation and dilution of body fluids. Though it shares similar name as diabetes mellitus, it is vastly different. A blood glucose monitor, which is a tool to measure glucose levels in the blood. Normal levels are approximately 70 to 130 milligrams per deciliter. Gestational diabetes is a form of diabetes mellitus that occurs during pregnancy. Once diagnosed with gestational diabetes, there is an increased risk for forming type 2 diabetes. Fasting, which is 0-calorie intake for at least 8 hours. A1C gives in the form of a percent the amount of hemoglobin with glucose attached. This helps assess the average blood sugar over the past 2 to 3 months. Insulin. Insulin promotes transport of glucose into cells. Insulin is produced by the pancreas. Prediabetes is when fasting blood glucose is elevated or an elevated A1C, though not high enough to be considered diabetes, though pre-diabetes can still have adverse effects. Diabetes mellitus type 1. It has also been called juvenile diabetes, though it can happen at any age. It involves the body making antibodies that mistakenly attack the body's natural insulin or cells that produce the insulin. Causes blood sugar to rise due to the inability to use the glucose in the bloodstream without insulin. Due to the lack of insulin, it is known as insulin-dependent diabetes. Diabetic ketoacidosis is a common complication of diabetes mellitus type 1. Diabetes mellitus type 2. This is often referred to as adult diabetes or non-insulin dependent diabetes. Approximately 90% of diabetics have type 2 diabetes. It is caused by reduced insulin production and/or cells that do not easily accept the insulin. May not be noticeable at first and often goes unnoticed for months to years. Symptoms of diabetes: polyuria, which is increased urination, polydipsia, which is increased thirst, polyphagia, which is increased hunger. Weight loss and weakness is common. Ketoacidosis, which is a medical emergency, is more common in type 1 diabetes, though it can affect type 2 patients if uncontrolled. Due to the inability of cells to use glucose for energy, the body breaks down fats for energy. This causes production of acids, leading to metabolic acidosis. Hyperglycemia, which has the symptoms of polyuria, polyphagia, weakness, blurred vision, headache, nausea, and vomiting. Symptoms of hypoglycemia include cold and clammy skin, increased heart rate, agitation, headache, nervousness, dizziness, faintness, unsteady of gait, slurred speech, hunger, and if severe, coma. Risk factors of diabetes include a genetic predisposition, autoimmune disease causing the destruction of cells. This can lead to diabetes, environmental factors such as viruses and increased weight, being Black, Hispanic, American Indians, Asian Americans, and Pacific Islanders are high risk. Much of this is due to cultural differences, which includes diet, health promotion, etc. Increased age is also a risk factor, as well as females that have previously had gestational diabetes. The chronic effects of diabetes include an increased risk of infection, increased risk of amputation, especially the lower extremities, higher rates of depression and anxiety, damage to vessels, damage to organs, including the heart, kidneys, brain, eyes, etc., damage to nerves causing numbness, tingling, and burning, which is called neuropathy, an increased risk of stroke, and prolonged wound healing. Testing and diagnosis begins with a history and physical exam, blood work like A1C, which 6.5 or higher indicates diabetes, fasting glucose above 126 milligrams per deciliter, which is further evident by symptoms of hyper or hypoglycemia. Repeat testing is done to confirm diagnosis of diabetes. When confirmed, frequent blood sugar checks are performed with glucose monitors, usually by the patient when they wake up, eat, and before going to sleep. New technology is allowing for continuous glucose monitors where a finger stick is not needed. Common medications used to treat diabetes. Insulin, which is classified by their onset, time, peak, and duration of action, includes rapid acting, short acting, intermediate acting, and long acting. Most of the time, injection is subcutaneously, though insulin can be inhaled. Oral medications include biguanides, sulfonylureas, meglitinides, glucosidase inhibitors, thiazolidine diones, dipeptidyl peptidase 4 inhibitors, dopamine receptor agonists, sodium glucose cotransporter 2 inhibitors, as well as combination drugs. Non-insulin injectable agents such as glucagon-like peptide 1 receptor agonists and amylin analogs. Diet and lifestyle changes are extremely important in controlling diabetes. This is especially true for type 2 diabetics. Nutritional therapy that is individualized to the diabetic, which includes counseling, education, and monitoring, weight loss for people that are overweight, education related to carbohydrates, fats, protein, and alcohol intake. Exercise is known to help decrease weight and lower glucose levels in the body for up to 48 hours. Especially with type 2 diabetes, normalizing glucose, lipid, and blood pressure is the goal. Please take this time to click the same link below this video and retake the quiz to see if you can do better on the quiz or understand the questions a little further.